We're going to be talking today about the things you need to know about patients who have had a hip or knee replacement. And there are some rules that they have to follow. I want to make you comfortable with the sense of how you get them up out of bed the first time. The information class that the patients have before their session does talk to them about the rules, about how to start walking, about the equipment that they need at home. So this will not be new information for them. You don't have to feel like you're teaching it to them for the first time. We know that they're ready for discharge if they can get in and out of bed by themselves, if they can walk about 20 meters safely with a walker, and if they can manage the stairs with supervision, but not assistance. So that's what we're looking for in our patients going home the first time. It's really important that the sooner they can move, the better, because it reduces the length of time they have to stay in the hospital, and it improves their confidence with how they're moving. You'll see that these are the rules that the patients having a hip surgery have to follow. They're not allowed to bend at the waist past 90 degrees, but no further. So I'm going to go now and bend over so that you can see what 90 degrees look like. If they were to bend down like this with their hands on their knees, that would be okay. That's 90 degrees. It also means when they sit, they have to sit on a chair where the platform of the seat is even with their knee or slightly higher. That way we know that they're not sitting with their hips lower than their knee. They're not breaking 90 degrees. My knee is about here and the chair is a little bit lower than that. So if I was having a hip surgery, this would be too low for me. And if you have a patient like that, you may choose to use a cushion, which I know you now have, on the chair so that it's the appropriate height for your hip patient. If they're a shorter patient, we don't want their legs dangling because that's painful. So in those situations, they might need a footstool, whether it's on the side of the stretcher or on the chair, so that they're more comfortable. So that's the first rule. The second rule is that they're not to cross their legs, not at the knee, not at the ankle, and not even to toe their shoes on and off. So I have brought today a shoehorn and a reacher, which is what we'll be teaching the patients to use. But if you see them bending over to put their slippers on, for example, we'd like you to stop them and assist them or give them a shoehorn so that they can do it safely, because we need them to get into those good routines even here in the hospital. Okay? If they're laying on their side, sometimes people will cross their legs. And so that's why we want patients who've had a hip surgery to put a pillow between the legs if they're lying on their side for comfort. And then the third rule is that they're not to twist. So if they need to turn, they're going to point their nose and their toes in the same direction, turning the whole body. And this is even if they're rolling over in bed. We want them to roll with their nose and their toes pointing in the same directions, not in segments, which is what many of us do. There's only one rule for patients after a knee surgery, and that is that we don't want a pillow underneath the operative knee. Patients shouldn't have a pillow at all under their knee, but if they're really uncomfortable and they need something for elevation, you can put the pillow lengthwise under the knee, but not crosswise, because that keeps the knee in flexion, and then it's really hard to straighten it when you take the pillow away. So we want to keep that knee in extension at rest. Now that doesn't mean that they're not allowed to bend the knee. They are allowed to bend the knee, and we want them to bend the knee. We just don't want it to be permanently bent when they're at rest. These are the guidelines we tell patients that when they're alert and they can feel their leg, we want them to start moving it. And we've given them the booklet with the exercises in it so that they know how to start moving their knee. If they've had a hip surgery, they can bend their full leg to get the hip and the knee moving. They're allowed to move their feet up and down. We tell our patients most of them will be able to put as much weight as they can handle through their operated leg once they start getting going. And realistically, if during the surgery the surgeon determines they can't put all their weight through their leg, they're probably not going home the same day. If they're a partial weight bearing or feather weight bearing, they probably need a bit longer in the hospital to figure out how to do it. So most of the ones who are going home the same day will likely be full weight bearing. What equipment our patients need to use when they get up the first time, and we will have equipment for you with the patients. There will be a walker which looks like this, 4 feet, no wheels, and the appropriate height of the walker when they stand tall within it is that it is even with the crease of their wrist, where you wear your watch, okay? We do have physiotherapists who are going to be coming and seeing the patients going home the same day, so they can confirm the height, and if it's really blatantly wrong, then they can fix it. But this is the appropriate height for someone. These are adjusted just in case you have to do an adjustment with the pins on the bottom, so they really slide quite easily. Okay? That is the basics of what people need to know for movement.